one main thing that stood out to me while researching this report is really the community orientation of nonprofit hospitals. So these hospitals come to really connect with the community, often as a result of their community needs assessment process. And really through this process, nonprofit hospitals come to understand the community's pain points with regards to accessing healthcare, but they also come to have a deeper understanding of the other concerns communities face, whether that's affordable housing, food access, education quality, or other community concerns that have come up. We're seeing that our nonprofit hospitals have become really well integrated into our health and social services systems in our state, and includes not only nonprofit hospitals, but also state and local health departments, various service providers, community groups, school districts, just to name some of those that are in partnership in this process. Our research finds that nonprofit hospitals are more likely to offer services that are either unprofitable or have limited profit margin, of course, alongside services that are profitable. But these kind of limited profit margin services may include things like trauma and burn care, emergency psychiatric or behavioral health services, home health care, and drug and alcohol addiction treatment programs. And then when we think about our rural communities, this is even more true. And so being able to provide these services, in addition to other things like health promotion and prevention education and things like that, are really important to these communities to help them sustain healthy lifestyles and address some health behaviors to help improve their overall quality of life. So things around skills around nutrition, physical activity, sleep, stress management, and mental health that really help prevent and then manage chronic conditions that both have individual and societal impacts. If we think about the individual impacts, these kind of prevention-oriented or educational-oriented classes can help improve individuals' life quality by reducing or delaying the onset of a chronic condition, as well as supporting them and their household's financial stability. When you think at the societal level, these efforts, when successful, help our system avoid those costly conditions like diabetes, heart disease, and things like that. Our nonprofit hospitals in Utah are really important to our state's economy. One way to look at this is Intermountain and the University of Utah systems are two of the largest employers in our state. And as of 2023, these systems provided employment to residents in 21 of Utah's 29 counties. So not just along the Wasatch Front, but in both our urban and rural communities across the state. In addition to providing robust employment, they also stimulate economic activity, and we see this through purchases from these systems to Utah-based vendors. And then finally, we see their kind of broader effects in their different community investment activities or their community investment portfolios. Some of the ways that we see this happening or some of the activities engaged in by our nonprofit hospitals include affordable housing initiatives, food security and nutrition programs, we've touched on that a little bit, as well as job creation strategies for our low and moderate income communities across the state.